Okay, so we've gone over the diagnostics, that diagnostic part of your first hospitalization. We've gathered a lot of material, both in the blood and your bone marrow, perhaps some additional testing, but all of that was done with the purpose to understand your specific type of leukemia, your other health comorbidities, to set you up for success for the specific and optimal type of treatment that will be best for your type of leukemia and the safest that we can give you. So your first hospitalization's first treatment will be called induction chemotherapy. This is your first cycle of treatment. This is delivered through a PICC line or a port, which we'll go over in a minute, but that's basically a more robust IV to deliver most of the chemotherapy that you will be receiving. It's also helpful to get lab draws as well, so we don't have to poke you all the time. And then your specific type of treatment for your leukemia will be determined through all those testing that we did before and with the help of our doctors and pharmacists. But it'll likely be some sort of daily regimen over a couple of weeks. This will be a great opportunity for you to work with the pharmacist as well, understanding, okay, what exactly does my daily regimen look like? And what are the exact medications that I'll be receiving as part of this induction chemotherapy? Now, I keep on using the term induction chemotherapy, but I want to kind of also go from a 30,000-foot view of how we approach treatment. So induction, which will be happening during this first hospitalization, our goal is to get leukemia into remission, or basically no more visible leukemia cells in the blood or the bone marrow. This will be intense chemotherapy, and the goal is to induce a remission of your leukemia. You'll then be discharged from the hospital, which we'll go over. And then the second kind of phase of your treatment will be consolidation. And that can either happen inpatient or outpatient, really depending on your type of leukemia. But the goal here is to destroy any remaining hidden leukemia cells to prevent relapse. You may have a similar regimen to what your first cycle of chemotherapy was, or something different depending on, again, what type of leukemia you have and the decisions that your care team makes with you. And then the third phase can come in a variety of forms, but basically it's our maintenance phase. We want to prevent the leukemia from coming back or from relapsing. And that can be done taking more maintenance medications, stem cell therapy. That'll again be a discussion with your care team. So the consolidation treatment and maintenance treatment are a little out of our scope for this first hospitalization, but I just wanted to give kind of a 30,000-foot view of what to expect. So we'll talk more about this induction chemotherapy.